A very good evening and good morning and good afternoon to those friends who join from other parts of the world. On behalf of our director, Reverend Dr. Sampi Thomas Chan, I extend a warm welcome and greetings to one and all. Today, we are happy to have Mrs. Cynthia Stephen, a social activist and a vibrant speaker, to take a session on pandemic COVID-19, socio-economic impact. And the session will be moderated by Reverend Jyoti Singh Pillai. Before I hand over the session to our moderator, I would like to introduce Reverend Jyoti. Reverend Jyoti Singh Pillai is presently the Executive Secretary of Women's Concerned, NCCI. She is an ordained pastor of CNI Diocese of Agra. Before joining Theological College and enter into priesthood, Reverend Jyoti studied BE Mechanical and MTech in farm machinery. Then she joined Theological College and completed BD and MTH in Christian ethics. Her husband is also a priest, Reverend Pratik Pillai, ordained pastor in Diocese of Delhi CNI. We are fortunate to have you, ma'am, this evening to lead the session. I now hand over the session to our moderator, Reverend Jyoti. Over to you, ma'am.
Thank you so much, dear Brother Minlu, for such a nice word of introduction. I would simply want to say that I'm a servant of God who is ready to do as he wills. Before we go any further, I would now take an opportunity to call all of us to come in the presence of the Lord and dedicate this time, especially that when we sit and discern and chat, this time can be a blessed one for each and every one of us, especially for our ministries in our respective places. Can we all give thanks to the Lord and look to the Lord in prayer? May we all pray. Gracious Parent God, we thank you for this time and opportunity that you have given to all of us through the intervention of ECC to come together and talk and listen to what is happening in our world and what we as leaders can do. And especially as today we are gathered to hear about pandemic and its impact on socio-economic. And when our moderator, Cynthia, would be talking to us, we pray that you would inspire all of us with the Holy Spirit, so that when we talk, when we listen, and we question and introspect ourselves, may we come to a consensus of a better leadership model, which is required for our churches, for institutions, and for Christian organizations. Bless this time and the intention of ECC in the name of God, the Father, the Son, and the Holy Spirit. Amen. Dear ones, it is indeed a pleasure to come together to talk about what the COVID-19 has left with us. For many of us, it has left us scars. For many of us, it has been an opportunity to reach to the unreached. And for many of us, it has given us a chance to change our view. It is very interesting that this Wednesday only, yesterday, we were talking in the Lenten prayer about spiritual intellect, the requirement of being creative in the ministry of the Lord. And it is so good that when we are going through this time of Lenten meditation in our personal and in our social lives, ECC has come forward to deliberate a series of webinars over pandemic COVID-19 and its socio-economic impact, how it has impacted socially and economically on our communities, on the communities that are associated with it, and what can we do so that the church, which is an egalitarian society, can be a gospel carrier for many. And for the same, We are blessed today. We are indeed favored by Miss Cynthia Stephen to be our resource. Before we listen to her, I would like to introduce our speaker, our resource for the day. Cynthia Stephen has passion for working with the underdogs in society and in policy advocacy for rights of women and children from vulnerable sections of Indian society. Writing, research, and training are her skills. She works with a gender perspective, and she has been at leadership level for the past 10 years and more. She was state program director for Mahila Samaika of Karnataka, a government project for the empowerment of women from 2012 till 14, with a budget of more than 300 million with 400 staff. She was invited on the committee set up by the government of Karnataka to amend the Panchayat Raj Act in 2014-15, which passed into law in state in 2015. She was awarded the state level Akka Award in 2016 for social work at various summitis. She is fluent in English, Kannada, Hindi, Telugu, and Tamil, conducting training in all of them. Translation from Kannada to Hindi and English is a forte. She has a long track of records of writing, training, leadership, and perspective building of less advantaged in the society. She is keenly interested in current affairs, political comments, and culture, especially in critique of culture from a subaltern perspective. She has published extensively on this topic, including few new features in journal articles, books, reviews, poetry, and opinion pieces. It is such a pleasure to have a person who has a heart, a mind to work for the subaltern. We normally talk, but here comes someone who can talk out of her experience. So we would now request Cynthia Akka, as we normally call her, to please take on the mic and share us on the impact of COVID-19 on our society in a socio-economic state. Over to you, Cynthia Akka.
Thank you. Thank you so much, Jyoti. It's a pleasure. Good evening, everyone. And I'm honored to be speaking to such a distinguished audience. ECC is very close to my heart. I've often been a part of programs being organized there, and I have myself been in residence once or twice to do some writing. So it's a lovely place, and to be invited by ECC to speak about the pandemic and leadership. Actually, we should talk about the pandemic and leadership, and also we need to talk about the pandemic and the lack of leadership thereof also. I think it's very, very important in this context. This is the first time in our generation we have seen such a pandemic. Some years ago, about 15 years ago now, we had the tsunami, and now we are seeing this horrible pandemic, which hasn't fully gone away, but is still around and is still working and active and taking lives and basically disrupting common people's lives as well as economies of countries across the world at various sections. Before I actually launch into the talk, I'd like to just share that this talk was scheduled long ago, but sometime last week, a few days ago, I was invited to a meeting, and I'll have to travel. I'll have to catch a train at 8 o'clock, and I live about an hour and a half from the station. So you will please, I beg your indulgence to speak till the 6:30, and then after that I will 6:40, and then after that I'll take a few questions. and I will then hand the session back to the organizers. If please excuse my having to leave a little early. Okay, so now one of the big things about the pandemic was that in the beginning there was nobody understood what is going on. That there was a new virus going around, which was a part of a family of viruses which is known to cause flu-like illnesses. Started, and we had already seen earlier that SARS illness, which was quite severe but not so contagious. So there's a big difference between whether, it doesn't spread the SARS did not spread very fast, but if someone got infected, there's chances of survival compared to the COVID was a little less. But in this case, what happened was the virus was new, the mutation was new, so its impacts were not fully understood. So researchers and medical researchers and doctors and pharmacists were all struggling and scrambling to try and understand how to respond to a person who had this illness. So it was basically, as you know, viral infections, you can't treat them with the antibiotics. They have to be treated according to the symptoms. So symptomatic treatment was given to people in the beginning, but subsequently there were some adjustments in the treatment protocols, because it was understood that people who are into who were given, for instance, anti-inflammatories like Brufen, were more likely to suffer severe consequences or even death. So there was a lot of scrambling, and there were a lot. So leadership of the highest order, especially in the medical field, so particularly medical research field, was seen. And also in one of the remarkable learnings from this at an international level was that economies or countries which had women in charge, I don't want, and I am saying this with some responsibility. I'm not saying it facetiously at all. Since my specialization is in women and leadership, particularly political leadership, I keenly study political systems across the world, and it was clear that at least in the first wave, countries which were led by women, New Zealand, the Scandinavian countries, in our own country, the state of Kerala, where there was a woman health minister, somehow they seem to be more responsive, and the comfort level, the distresses that people and patients felt, that and systems were much more responsive where women were concerned. So you can see that in this kind of a healthcare crisis, the sensitivity of seen, and so it was very clear that this was one of the factors in the fact that, say, New Zealand didn't have a very good, had a very good survival rate, and infections were not very high there at all. So apart from the fact that it's an island country, but quick action was taken by the leadership, the lady prime minister over there. And so therefore, is it that women are better leaders of crisis? I'm just leaving that there for us to think about and then move on. Who and what is leadership is an important aspect. I'm thinking particularly of a doctor who came to light in public much before the pandemic took place, but his example is something that we should have learned from, but failed to do so. I refer to Dr. Kafil Khan, who was a pediatrician in a hospital in Gorakhpur, and he and the district hospital there was suffering from a lack of oxygen. The lack of oxygen was not because there was no oxygen supply. The fact is that oxygen was available, but the bureaucracy had not paid the supply the supplier, and the supplier had kept giving them credit to an extent where he was almost going bankrupt. So he could not give the supply, as a result of which we saw that newborn ICUs, NICUs were seeing deaths of babies. So we saw Kafil Khan running from one place to the other physically to pick up oxygen cylinders. And so this was an emergency response, an operational emergency response by a medical doctor. He is not an operations man, but he's not a logistics man, but he was rushing. So in other words, the pandemic had a lot to do with medical issues. It had a lot to do with funding issues. It had a lot to do with policy issues, and it had a lot to do with logistics. And a failure at in any of these levels was sure to cause very serious damage. So we saw situations where crematoria in Bangalore, we have a number of electric crematoria, and because they had been burning continuously for days and days, the metal fixtures started to melt. They had to shut down, in series, a number of the crematoria to allow the machines to be, serviced, take away the melting parts and put in new parts. That was crematorium workers. They were at night. Nobody talked about them, but they were the ones who really saw that our the near and dear ones who passed away due to the impact of COVID actually were able to get decent funerals. And so nobody knows the kind of trauma they underwent. I happened to visit and talk to a few people because there was a very beautiful story, news report of done by First Post, in which my daughter, being a reporter, was also contributed. A number of the metro cities crematoria were covered, and there I was sensitized to the what is going on there. And as a result, we were able to reach out to them, and some friends from abroad raised some cash award to be distributed to the crematorium workers in various cities. And in Bangalore, we were able to do something for a few of the crematoria workers in Bangalore. There are a number of crematorium workers. So these were the leaders. The leadership was seen among the crematorium workers. The leadership was seen among the ambulance drivers, among those who were in the mortuaries. The leadership was seen in the doctors and in the nurses, particularly the nurses, because the nurses are very much more closer to the patient, physically handling the patients and so on. And we saw a lot of leadership in those who are supporting the rest of society. The cities of India, we have what we call the citizens groups which support the legal, the police and so on. No? So the civic society forces like the traffic wardens, the home guards, and such like were also pressed into service in order to maintain lockdown, and to seal down buildings. The BBMP, that is the corporation workers, were there who were monitoring the roads. The police were there who were monitoring the movement of people. So there was a whole lot of civil society activists, actors, police. These are all known as frontline workers. The doctors, nurses, mortuary people, crematorium workers, all these were what we call frontline workers. But there's a huge back end as well. So we had, I myself, to share some experience, as already Jyoti has said, we worked because of the lockdown. All the daily wagers lost their livelihood. So construction workers closed down. Construction workers lost their jobs. Domestic workers could not go to work because there was a lockdown. Nobody was allowed to come or go into any of the apartments or any of the houses, walk on the streets. Shops were allowed to open only for a few days, and roadside vendors were given timings, and only a few door-to-door area sellers were there. So the mass of population in the cities who depended upon daily income were pauperized, I would say. And a lot of the times they could not afford to buy food, they were starving. So we had community kitchens. I myself was part of a community kitchen effort where a wedding hall, Shadi Mahal, was turned into a community kitchen. 10,000 hot meals a day were cooked around 11 o'clock. They would finish the cooking, they start cooking in the morning. Simple dal and rice with vegetables was cooked, packed hot, and by 1 o'clock we would get the packets of hot food in bags, in sacks, and we would load this into the car and among the hungry. And we used to, it was people who see us who have received the food, they still they still remember, they say, we want, to support you in everything you do because you fed us when we were hungry. So this is the way. So these people who produce these 10,000 meals, the ones who packed the 10,000 hot meals, handling hot food is not easy, and then transported the food while it was still hot to a pickup point where we then picked it up. All these backend workers were not were leaders too in their own way, and they were part of the effort, but they were not really known till a long time, till many weeks later. Then there were also a lot of people, common people who are, like, for instance, common IT workers whose daily routines were not that badly affected. They continued to work from home. They continued to live in their own homes. The only thing, they were not commuting, and their incomes did not go down. So I have a number of friends and friends of friends who felt guilty that their life was going on as if nothing had changed, and so they knew that so much was happening on the ground, and people were losing their near and dear ones, but nobody was able to do anything much. So they started encouraging people like us who are with the on the ground to take donations and start distributing rations. After a while, even the distribution of rations became difficult because people couldn't afford to buy gas. I even had somebody donate gas cylinder to a woman who was too poor and too sick to go out and buy any food, or so so common people who became very responsive also became part of the response. In all this, where was the government and what was it doing? We saw that medical beds, the availability of oxygen beds was a problem. In one particular district, which is a border district, a little remote, hilly area, also a border district with River Valley, Chamrajnagar. That is very close. It was part of the district, Mysore district earlier, and was divided off. And so it was very much dependent on Mysore for a lot of its things. So the district hospital used to buy oxygen from Mysore. So because of the high demand which went up for oxygen, there was a delay in the supply of oxygen tanks. And in one day, 34 people in the ICU died. This was an avoidable mistake because once after they checked it all up, they found that one tanker was delayed for bureaucratic reasons. Similarly to the mention I made of the Gorakhpur child deaths due to oxygen shortage. So in other words, our bureaucratic system was not geared up at the ground level to respond to this huge pandemic. And so there was people who should have taken the lead, who should have been in the forefront of making decisions. And of course, the government talked a lot, but people are not empowered. The bureaucrats are not famous for taking bold decisions. They hesitate to take decisions. And so this was the reason why a lot of the huge lacuna in our healthcare system was opened up. we who are working in the social sector, we've often said that the health and education sectors in our country are very important. Am I audible? Yeah. Okay.
Yes.
Yeah, we've been advocating for policy change at the government level to raise the education budget to at least 6% of the GDP, and the health budget, it is some of the lowest in the world. We have barely 2% of our GDP spent on health. So now I think the demand, the need for the accumulated deficit of health services and infrastructure was seen in the heavy loss of life as a result of the pandemic. And this is where the true leaders shone. So here in Bangalore, we saw a team of volunteers called Mercy Angels, who were actually burying physical, they were ordinary people like you and me, but they were burying the dead when the families of the uh, people who passed away were not able to even see their faces. So they became the families. They were the ones that they were all mostly were Muslims, a very few Christians, maybe one or two Christians, mostly Muslims, carrying out all the rituals that Hindus normally carry out to send a person off during cremation. So this was the way in which the true leadership of the common person is was shown during the pandemic. And this was where accumulated lack of leadership and lack of political will was exposed. As a result of which, I think now, at least in Karnataka, I can speak from the state of Karnataka, they have tried to enhance the quality of the um, uh, health infrastructure, even in district and taluk levels, even going down to the community healthcare systems in the in large villages. So in a way, we have taken lessons from the mistakes of the past and try to move ahead, trying to bring civil society and corporates to pay for the extra infrastructure, for instance, oxygen plants, and increase the number of oxygen beds, ICU beds, and so on. So actually, this pandemic showed up the gaps in the leadership. I am not even going to go into the way in which the union government, the number of policy failures that we were able to notice. However, the doctors at the ground level in large hospitals, the researchers, they were very, very responsive to the needs of the people and kept talking what is a good thing to do, what are good practices to follow to avoid infections, and how to handle it, because COVID was not as contagious and as fatal as the SARS-CoV, which had happened some years ago. So as a result of which, the common people were turned out to be the real leaders in the pandemic. This has been my experience. And despite the massive loss of life, the tragic fallout of which we are still seeing, as since I work in the among the poor in the urban sector here, we are seeing thousands of children dropping out of school and college because parents cannot afford to pay the fees. Uh, Much of the employment generation has still not started for those who are in the daily wage sector, the informal sector, and income levels are quite low. Jobs are not easy to find. So there is still a lot of economic distress as a continued impact of the pandemic. So we need to pray at first for healing of the body, mind, soul, and spirit of our people, because everybody has been affected very badly. For instance, my daughter herself, I told you she was reporting during that period, but she found it so traumatizing that she actually quit her job after 9 months. It was a new job that she had taken up. Just a month or two after she started the work, the pandemic struck. So right through she was writing on pandemic related work. She said, I can't handle this amount of grief and trauma. I'm giving up my job. So like that, there were so many people who were affected very, very badly. There was one lady who lost her husband, and she had two small children. She herself got COVID. She's a person from another city, and had married and had no family because she had married against her parents' will. So after that, and she had married into a different religion. So no support at all for this woman with two infant children. And she was all alone in the house and struggling to manage. And we had people, as I told you, community kitchens. So there were community kitchens who were supplying cooked food to the those who were confined to the house due to COVID and could not cook for themselves. And so that was also some of the initiatives for. So ultimately, what turned out, who were the winners and who were the leaders were the common people and the NGOs and civil society. I think as churches and as individuals who are actively involved at various levels in our country, in our own cities, and also working with among the poor and among the needy. I think these are lessons we would like to learn, that the mercy of God, they are new every morning. And, the compassionate heart of God is there, and it beats in the heart of every human being who wants to respond to the challenges of another. So I would like to just stop here so that we can get some interaction. Thank you for your patient hearing, and thank you for the opportunity to share my experiences. Over to Jyoti.
Thank you so much, Cynthia, for leading us through this time of conversation. You very beautifully brought out the practical approaches, the practical measures that many of the church people, many of the NGOs and common people had taken. And indeed, that is what kept pulling our society to meet the ends need. It was such an inspiration to know how various NGOs, how various people had worked. You also brought out that how important it is to be involved, because from involvement, what you shared, that those who were not affected economically found a spiritual or a moral burden to help those who were in need. So that was again a driving force, the moral implication, the moral burden to carry each other, because we all are human. This came out very beautifully from your from your presentation. Another thing that you very beautifully pointed out was that we have means, we have measures, we have cycles, we have processes, but our hands are carved, our hands are stringed, our hands are bound, because the local ground level bureaucratic people cannot take decisions. So the lack of decision making capacity at the bureaucratic level, at the grassroots, led to much of the chaos which could have been avoided. So the need of permission to take necessary decision at the right time is required. You also very beautifully brought out the importance of operational management, how to do the end moment or the present fixation in the smooth running of a program, of a process is required. So you also brought it very nicely, that operational management response is a must, and everyone should be intellectually and morally equipped for taking the response in the operational management. You also brought out in your presentation the gap in the leadership and the policy making. So with that, I really am very thankful that you brought to our focus once again that the real leaders who emerged during this COVID were the frontline leaders like doctors, crematorium workers, the people who were first-handedly acting to support this system. Now, I would request all of you to please give your comments, suggestions, and also what you would like to end on how we as the church, we as Christian organization, we who are compelled by the gospel of Christ can support in management of these problems, like operational management response, how the church and all of us who are driven by the gospel of Christ can respond. Few of the suggestions were already made by you. First, that you brought out was those who are least affected can be a supporting hand to those who are more affected, giving to the needy, being responsive to the mental health of others, and how we all can give away what we have, and if we cannot give away, at least how we can participate that others are supported. This is what your presentation was beautifully done by you, and we are so thankful to you, Cynthia, for it. Now the floor is open for everyone to please give your comments, ask questions, and help us to make a roadmap ahead on how we can respond to the socio-economic impact of COVID on us, on our society, on our church and church-based organization.
చెప్పినాను రెడీ ఉంటాడు ఆడుకో పోలే ఇంకా 5 minutes పోలే
The mic, the floor is now we would now request you all to please respond or add to what you want to say. All of us are leaders in our own capacities. All of us have done various things. If you want to add to what Cynthia Akka has said, if you want to share any more stories, you are please most welcome, and we'll have another 10 minutes for it. 5 minutes, Cynthia Akka is with us on video, and after that, we can still go ahead.
Yeah, before that, I'd just like to, since no one has taken the chance, I'd like to just point out that one of the opportunities, both a challenge and an opportunity, is for equipment like oxygen plants for mission hospitals in remote locations. A lot of manufacturers started manufacturing oxygen plants, and they're available. And there are corporate entities or others who are willing to make these donations, particularly to people who are remotely located. And now people are beginning to it's people who have mission hospitals to reach out, people who live in a remote location to reach out and maybe grab this opportunity, because it may not happen again that so many oxygen plants are manufactured and made available. Donors are available to donate these equipments to these institutions. If anyone wants to take this further, please contact me through Minlun or Jyoti, and I will be able to. And I will put my email on the chat box, and you can reach out to me.
Thank you so much, Cynthia Akka, for opening this avenue for everyone, that oxygen plants can be made available to the remote areas. Indeed, if I'm not mistaken, and as the policy of the government says, that every hospital which is more than 500 bed need to have its own oxygen plant, which is normally overlooked when the hospitals are made. Many of our Christian hospitals survive because we, being Christian, are ethically compelled to follow all the norms. So many of our Christian hospitals could survive this lack of oxygen because we had our own oxygen plants. Yes, like in Delhi, St. Stephen's Hospital had its own oxygen plant. So it could help many. So it is wise, and if we know of any hospitals which are in need, which are smaller, and they want to have an oxygen plant, you can contact Cynthia. See, today we may not need it, and God forbid the second wave should come again. But the condition that it has led to many of us physically, we would need oxygen at time or other. So this is an opportunity. Educate your churches, educate your small hospital, educate the people to be equipped with oxygen, and any needed, what Cynthia Akka has told, operational management response, we all should be equipped with.
So it's almost 6:45. If you'll excuse me now, thank you so much, Jyoti, and thank you all for graciously permitting me to leave. Thank you very much. It's my honor and privilege. Thank you so much.
Thank you so much, Cynthia Akka, for being with us.
Okay, bye-bye.
And safe journey.
Thank you. Bye, Menlo, and bye, Jyoti, and everyone. Thank you.
Yeah, ma'am, thank you so much for sparing your valuable
welcome.
time. Yeah, in spite of your busy schedule, and sharing your practical steps that you have taken during the COVID, and then the initiative that you have done opening up the community kitchen, that was greatly inspiring. And you are indeed a person, a woman of action, I would say. Yeah, thank you so much.
Thank you.
And we wish you all the very best for your next lecture. And we look forward to have you in another platform. Thank you so much.
Thank you. Bye.
And I would like to request Achan to say the word of thanks, our director, Reverend Dr. Sampi Thomas. Before that, I would like to announce the next lecture that is on 7th April 2022. That means next Thursday. The topic will be social and digital media in Christian ministry. And the speaker will be Monsignor Jayanathan. And we request you all to participate even for next week Thursday lecture. I request a director, Reverend Dr. Sampi Thomas, to say a word of thanks and close the program.
I take this opportunity to thank you all for your participation in this lecture. I am very inspired by this evening's lecture, especially when Mrs. Cynthia Stephen started off by saying the pandemic had also shown a lack of leadership. In fact, we were focusing on Christian leadership during the pandemic, or leadership patterns during the pandemic. And it was a caution that she had given us that at times there can be a lack of leadership. So we need to explore as churches and as persons and institutions, where did we lack leadership when this pandemic had emerged? And in what way we can be prepared, and in what way we can help our leadership groomed in such a way that when a sudden pandemic or a disaster or crisis advent on us, the leadership will not be found lacking. I remember the burials that I had to conduct for COVID affected persons, dear ones who did not have their dear ones from the family to bury them. So leadership, the very definition of leadership needs to be recast, because leadership is not leadership when everything is smooth and fine. So leadership also should have some element of how do we give leadership in times of crisis. So I'm sure that the theological colleges, churches, institutions will bring in this aspect, leadership in times of crisis, as part of our training and grooming. And I'm very thankful to Mrs. Cynthia Stephen with that initial statement, and also for the various aspects that she had elaborated, highlighting the unsung heroes of the pandemic as credible leaders That was a very wonderful way of looking at our leadership concept and leadership practices. Even though our Deputy Director, Sri Milun, had already expressed our thanks to Mrs. Cynthia Stephen, and even though she had left, I take this opportunity to express our gratitude to her for her participation and leadership. And we had a befitting moderator in Jyoti. She also have put the various issues in perspective and have done a wonderful leadership role in guiding this session. And I wish her the very best in her NCCI leadership role and thank her for her leadership in this webinar. I thank you all for your participation. Our former director, Dr. M.G. Joseph, and all others have kindly participated in this program. I thank one and all and look forward to your participation on next Thursday as well. Thank you. Have a good evening and may God be with us all.